So the selling points that's unique about NurExone, and I think we discussed it before, is the ability to not only have a product and rather have a platform technology that support product. We own our own IP. We know that we have freedom to operate, and we know that we can apply those technologies to other indication and other products, and we are not just a one product company, and this gives a huge advantage when you want to develop a company that needs to live and grow with the time until we release the first product. And usually pharmaceutical or biopharmaceutical development takes between 8 to 12 years. So this gives us a very strong backwing to continue and develop. Second, and I think it's really also important, and a lot of CEOs do not really give attention to that, is the fact that we have a very, very strong scientific team. Our R&D team is only at the moment PhDs with experience in the EV field. So also the human resource of our company is very important. And when you invest in company, you need three things. You need a good science, you need the company will have money, and I think the most important is the team that you create. And I think this team is scientifically very strong and also business-wise very strong. Our business development and the chairman is the professor, is the Mr. Yoram Drucker, and he is a serious entrepreneur, was involved with several publicly traded companies such as Pluristem, now the name is Pluri, and Brainstorm. Both of them are late-stage pharmaceutical companies. Exosomes they are good for a lot of indications. We chose spinal cord injury for 7 reasons. First of all, acute spinal cord injury is considered orphan designation in the US, since you have around 18,000 new patients a year, which is by definition orphan designation. So we try to find what is the easiest way to continue and develop our product to clinic. Our exosomes, and I mentioned it before, target specifically neurons, and this is related to the source of our cells, the source of our EVs, that is our bone marrow mesenchymal cells, and those the exosomes that we produce from them has a stronger affinity to neurons, and the fact that those EVs can home to the neurons and integrate and engulf into the cells in the area of the injections, of the injury, sorry. This will create a huge opportunity of a very specific delivery and regeneration in a certain space that needs to be repaired. So there are several approaches how to deal with this challenge, and this is a huge challenge for many, many years. I think this is the holy grail of science. A lot of scientists try to find a solution how to create a regeneration of neurons, especially in a spinal cord injury. There are some approach of using cells, which has advantage and disadvantage. It's a personal medicine. You need to adapt. It's very costly. And with the years, they understood that actually the cells are not the product, and what is the product is the EV that they secrete. Other approach, which shows some results, but it's very invasive, is using electrical stimulation, having a device and try to bridge between the neurons over the impact or the injured tissue in order to, pass the signals from the brain to the legs. It shows some results, but again, it's very expensive. You need to go to a special clinics for that. It's still underdeveloped, and it's very invasive.